Hi, this is David Dillard, and talking to you again from Sleep and Sinus Centers, and into our blog slash vlog, or the media that we're looking at, trying to teach you a little bit about sinuses and allergies. And in this case, we're going to talk about irrigations and some things that you may not have heard about in the past. So we talked about in a different video how mucus is essentially a method for keeping moisture inside the body. That inside the nose you don't have like skin, where the skin has a almost saran wrap like quality to it, where it traps moisture in, and it's a plastic kind of material that people used to use to trap moisture in food. But the skin is something that keeps the dry out and the moisture in and separates us from the rest of the world. And inside the lining of the gut and inside the lining of the respiratory system, like the nose, you need to have the ability to have that tissue be moist. So the solution that the body has come up with is to use in these tissues a substance which is mobile and flexible and is effectively quote unquote wet, but is actually not water, and that's mucus. And mucus is actually a pretty amazing complex, and it's made up of a long chain of sugars. If you take sugar and throw it in a pan and heat it, it becomes caramelized. And really what that means is you burn a little bit of it, which gives it that golden color, but it also gets sticky. It's not just sugar anymore. And that consistency is because the sugar molecules, with apologies to my chemistry teachers throughout the years, which are usually 6 and 5 chain carbons, get linked in these big long chains, and they basically become cables. So we call those polysaccharides, and in this case, sugar has a lot to do with mucus, and mucus is basically a series of sugar and protein molecules that float on top of water, kind of like this. So it creates plates of these globules of sugars that are not quite all together, and then they are held in place in part by their attachment to the water and to what amount to large fingers called cilia, which are things that move the mucus along and help us to keep it constantly being reproduced, and produced in glands that are on the surface of the lining inside the nose. And when this stuff gets backed up, because say the sinuses get infected, they get swollen, rather like if the paint was moving out that door that we're in, and constantly being pushed to that door. If you shut the door, the paint would back up. So one of the things that you can do is you can irrigate those kind of inflamed, infected mucus collections and help keep it washed out. But a lot of times, if we overdo it, or it gets too dry for some reason anyway, you can have these segments where the tissues underneath become damaged down here. And it's helpful, just like it's helpful to put ointment on your lips when they're chapped, it's helpful to put creams and ointments on your skin when they're irritated or chapped, or you've got an abrasion like a skinned knee. It's helpful to put something over that. And that is what I call like a nasal emollient, because skin emollients help us do that. And so nasal emollients have to be certain qualities to be safe. So it's careful how you choose these. You want to be very careful how you choose these particular compounds. So if like you use Vaseline, which is a bit of a problem in some instances, you can actually inhale globules of Vaseline or the white petroleum jelly compounds, which is a very long chain carbon atom, and a mixture of those, and great for a lot of things, not really good up the nose. And the reason it's not good up the nose in large quantities is that you can suck it into the lungs, and it's very difficult to get out of the lungs and can cause an pneumonia. So we want to avoid things like that. So shorter chains can be safe, or you can use stuff that's made out of water-soluble stuff. And those kind of things are like the saline gels. Now, straight saline sprays in the nose do help keep it moist, but it's kind of like taking your skin, you've got a wound, and if you want to keep it moist, you don't stand in the shower all day. You have to put something on it so you trap your own moisture in. In this case, if you use a straight saline spray constantly, you're simply washing off that mucus layer that we talked about, and that's not really helping things. You need to help reproduce that mucus layer. These things that we're going to be talking about are basically artificial snot, okay? So these are like AYR gel, which is brand name, and any sort of saline gel you are looking at is useful. The Neomed, which is a common brand name in our area, also makes a spray gel. And some of these gels are not only in little tubes that you can squeeze out, but they also come in these spray bottles. So the spray bottles take this, it's kind of like using a power sprayer for paint, and pump it up into the nose where they really need to be. And those things are very, very useful. The small gels, if you stick them inside the nose, you can at least try and snort it into the area by forcefully inhaling to get it where it needs to be. And then you have certain types of oils that are similar. They're short, they're designed to go in the nose. The one that comes to mind is Ponaris. Not that I have any particular interest in any one of these companies, but this one is one that's been around for a long time. It's old. I'm certain there's some other ones that are out there that I'm not aware of. But if you probably Google these, you'll be able to get these. They are not always at the pharmacy. You oftentimes have to ask the pharmacy to actually locate them and buy them for you. Using them a couple of 2-3 times a day quite frequently will help alleviate that. People who are stuffy and don't seem to have a whole lot of relief from a lot of the normal things that are prescribed quite frequently will have a nose that's irritated by being too dry. Maybe it's the environment, maybe it's the medicines they're taking. Medicines can make you too dry. Certain medical conditions can make you too dry, but the mucus is not immune to that. And so these things, if you're constantly feeling irritated, may be a simple solution also to some of those conditions. You'll know right away whether or not it's going to help because it'll feel better. As always, we hope this is helpful for you, and we will see you again next time. David Dillard from Sleep and Sinus Centers. Thank you.